A new CDC report shows nearly 2/3 of drug overdose deaths nationwide involve synthetic opioids like fentanyl. News 8 Now's Jordan Fremstad spoke to a La Crosse expert about how the opioid crisis has changed for communities like our own.
Drugs in our community are stronger and they're easier to produce and they cost less money, but a bigger problem is users often don't know what they are taking and more people are dying as a result.
The margin of error is shrinking as drugs grow in strength. The opioid crisis began with drugs you can get with a prescription at a local pharmacy.
And then it transitioned to heroin, and then it has transitioned into the synthetic opioids over the course of the last few years.
Gunderson's Dr. Chris Eberlein says these drugs are tougher to track because they are produced in hidden labs. The drug is also cheaper to produce and it's easier to move around the country.
So from just the logistics of dealing this sort of substance, it's got a lot of advantages.
A new CDC Morbidity and Mortality Weekly Report focused on data from May of 2020 and April of 2021. They estimated the number of drug overdose deaths in the United States exceeded 100,000 over a 12-month period for the first time, with 64% of deaths involving synthetic opioids. Robert Walensky, Drug Task Force Investigative Coordinator of the West Central Metropolitan Enforcement Group, told me in an email, "We are dealing with pills that closely resemble actual pharmaceutical pills that are illicit fentanyl." He said, "I can't tell you the last time I saw or even heard of pure heroin, as all of it in this area now is mixed with illicit fentanyl. Fentanyl is 100 times stronger than heroin. To put that into perspective, take a look at this photo Eberlein shared. This amount of heroin is the same as this amount of fentanyl."
It'd be very, very easy to overdose. You're talking microgram differences.
Fentanyl requires a substantial amount of Narcan or naloxone to treat a drug overdose patient.
15 years ago, our typical dose of Narcan is about 0.2 milligrams. Now we're starting off at 4.
You heard that right. 20 times the amount of Narcan is now needed to save a life.
Society as a whole is burdening the cost of this.
The CDC's report calls for urgent action to slow this trend.
If there isn't a demand, the drug wouldn't be here.
Eberlein says they focus on the mental health side of this complex puzzle.
So we have to get to the point where these patients are, the mental health and their addiction is treated.
Stronger treatment to combat these stronger drugs.
Now, Eberlein says leaders work to get fentanyl test strips into communities. Now, these allow people who use drugs to test for fentanyl so they can at least know what they are taking.
All right, thanks a lot, Jordan. Eberlein says he knows people who completed treatment programs in La Crosse who now live productive lives. He says the community needs to continue these efforts.